Oh, hi guys. Wade Baskin here, Doctor of Physical Therapy. Thanks for landing on this page. Obviously, you are trying to find the best physical therapist for you or someone you care about, and I think I can help you with that. Um, I have been a practitioner, a private practitioner in physical therapy now for a little over 20 years. I graduated in 1991 from University of Mississippi Medical Center, and I've since gone on to recomplete my doctorate, and then also I went to Northwestern University in Chicago there for a while. Also went to Delta State University, Bleed Green, Fighting Okra um, for my undergrad, and then hey, as far as high school goes, Cleveland Wildcats over in Cleveland, Mississippi. So been around a little bit, but I've been again in private practice now, physical therapy practice for 20 years. Prior to that, I worked, of course, in hospitals, home health, nursing, homes contracts, in corporate settings. I've kind of run the gamut, pediatrics included. I've run the gamut of what we do in physical therapy. And I can't speak for any specific organization, of course, except for ours. However, I can tell you the difference between good and bad physical therapy, okay? So we want to focus on finding you the best, the absolute best match for you in your particular situation or needs. You know, of course, as physical therapists, we're usually dealing with someone much like yourself who has an issue with either pain or a motion problem where you're trying to heal from either like a surgery or an injury. And, you know, in sports medicine, we're working on improving performance a lot, but hey, life is a sport. So you just may be trying to get back in your garden or being able to sit at your desk for 10 minutes without having to shift around or just bend over and shave or cook or do the housework. Who knows? I mean, that's what you have a physical issue, you should see a physical therapist. However, you need to find the right physical therapist for you. What's good? Let's talk about that. Here's the good. Good is when they're doing some type of a skilled hands-on procedure, not just running you through the mill of doing some exercise. I mean, you're going to be paying a pretty penny for this, and insurance might cover most of it, of course. However, let's say you did have to pay for it out of pocket and you want to get your money's worth. That's the way we design our therapy at our practice. In fact, ours, if you want to go ahead and look us up, you can click the link below, and we're going to, of course, we think we're going to give you the best available. But let me tell you what's good again and what's bad. Hands-on. Okay, not all the time, but just at least guiding you through the process. In fact, if your physical therapist has advanced training, say, in a specific manual therapy, look that up, manual therapy. Manual trained physical therapists get better results than non-manual trained physical therapists, and that's research. I'm not just saying that and making it up. That's why I went early on in starting in school, started getting specific manual therapy training, because someone who knows how to put their hands on you in a way that can speed up healing and get you moving better, faster, stronger, that's what you want, instead of being pushed through a routine where no hands-on is being used and it's up to your body to kind of correct itself, which sometimes just can't happen. Okay, so hands-on, that's what you want. Are they manually trained? Do they give you consistent instructions as to how to take care of yourself once you're done in that particular session? I'm talking day to day to day, session to session. Are they telling you little things as to what to do, how to take care of your exact condition? Okay, are you always moving towards your goals? Your therapist, he or she should be telling you not only what they expect in terms of goals and as far as performance in therapy, such as in 2 weeks I expect you to be being able to touch the floor. In 2 weeks I expect you to be able to climb these stairs or whatever. In 4 weeks I expect you pain-free, sitting at your desk, reaching over your head, throwing the ball. There should be a specific time frame and a specific goal, a measurable goal. All good therapists will be talking to their patients about that and moving their patients toward those goals, okay? Let's talk about red flags. These are the things to watch out for. The no-nos. All right. So no hands-on. You just walk in, they give you a sheet of paper, and you're on your own. If you feel like you could be doing your therapy at home, there's something wrong there, okay? All right. Now, granted, there are some things that are a little repetitive, but your therapist should be explaining why and maybe, giving some input, because, I mean, I've had some patients where I had them do several repetitions. I'm right there with them. My technician's not doing that, and that's the next thing. If the support personnel, the aides or the technicians, are the ones setting you up or guiding you through or even performing some of the therapy, there's a little something wrong with that. Your licensed physical therapist or your licensed physical therapist assistant should be the one performing the actual procedures and techniques on you. The technician or aide can guide you from station to station, or they can set things up, but any changes made, any procedures done to you that involve skill, that's up to the licensed provider there. Okay, so if you've got a technician performing the bulk of your treatment there, and that's who you think your therapist is, especially if they're putting their hands on you doing something and that's being billed for, that's wrong. Okay, now billing statement. Hey, make sure you check that billing statement, people. We try to be very cost effective. Okay, and that's what physical therapists are known for. In fact, there was a good old study, and it still stands up today. Like, for every dollar you spend on rehabilitation, you're going to save $12 in future medical costs. So, and it's unfortunate that sometimes reimbursement just doesn't allow enough money for you to come get therapy and have it fully paid for. Because I mean, I'm telling you, when your body is healthy and moving well and doesn't have pain, you don't need as much of that expensive medication. We can prevent surgeries and things like that. So, I mean, hey, we're very cost effective. So check your billing statement. You shouldn't be getting a $50 charge for a hot pack. Okay, make sure that your statement is accurate and that you're getting the procedures you're being billed for. You're actually doing therapeutic exercise, therapeutic activities are common words you'll see on there. Electrical stimulation, whether it's attended, they're working with you, or unattended. That means they turned it on and you're there with it on, and they don't have to be right there with you. Okay, neuromuscular reeducation, they're teaching you movements. Therapeutic activities is more like a one-on-one, them doing something with you to improve your coordination, your flexibility, your performance, advance your healing. Therapeutic exercise, yeah, that's when you're going around and you're doing these special exercises they prescribed. Okay, so those are all good things that would be legitimate on there. And manual therapy, that's one of my favorites, of course. Okay, so that's when the therapist puts their hands on you and performs some type of a skilled maneuver. Okay, and that could be anything from joint mobilization to spinal manipulation to myofascial type stuff, any kind of release, some kind of release work that you might hear the therapist talking about. Okay, but check your billing statement, make sure that is accurate as to what you're getting. All right, so hey, those are the main things. There are others, but if you are unsure and you're not in an area where we're located, again, click that link below and you can find us, and we'll be glad to help you in any way possible. But if you're in an area that's not close to us, we'll be glad to look where you are and find a suitable provider for you. That is not a problem. That's a great service that we offer. We know how to look for the good, and we know how to determine the bad, and we usually can find the ugly as well, and we try to avoid those situations and get you in the good. Okay, so you deserve it. Our profession can do a lot for people like you. I mean, I love what we do. I love what our knowledge, our profession can do to help people, and we like to do it fast. In fact, in our clinics, if you're not getting a 50% reduction in pain on your first visit, that would be surprising to me. I don't care how long you've had your pain syndrome or your problem. Even on surgeries that come in that expect to have this excruciating pain for like rotator cuff repair or total knee replacements, we're able to get by without near as much pain as they expect. And then we get them better faster than many times the doctor expects. So we're doing something right. Hey, we like what we do. We're not just working a job. It's our life. Okay, all of our therapists are like that at GT Physical Therapy. So we'll be glad to help you here. If you are concerned as to whether this would be for you or the person you're trying to help here, we'll do a free screen. Okay, just give us a call. We'll be glad to get you in and check and see if we can do something for you. And if we can't, we'll find someone who will. If we decide to work with you and you become a patient of ours, and then it's not working out, well, guess what? We do have a body back guarantee. If you don't like our work, you can have your old body back. I'm just kidding on that. Actually, we look forward to helping you in any way possible. And be sure to give us a call. Check us out on the link below. And have a wonderful day, a blessed day, and be well. This is Dr. Wade Baskin with GT Physical Therapy, wishing you the best. Take care now.